slide. Can you hear me?
Indeed. Mm-hmm.
Okay, awesome. So thank you for that introduction, Dr. Rutberg. Like you said, my externship was with the Animal Rescue League of Boston. It was done completely virtually this summer. I had originally planned to be out in the community with their community outreach team, but unfortunately due to COVID, everything was shut down, and I'll of course talk about that in my presentation. I'd like to acknowledge my ARL site mentor, Cheryl Traversy, and my academic mentor, Dr. McCobb, as we get into this. So just to do a brief overview of ARL, the organization and their mission. Their mission is to be an unwavering champion for animals in need and to be committed to keeping them safe and healthy in habitats and homes. ARL has been around for quite a while. They were founded in 1899 by Anna Smith Harris. They currently have 3 locations, so in Boston, Dedham, and Brewster, and those locations have both adoptions and relinquishment capabilities. So they have a wide variety of species. So they can have dogs, cats, your typical ones, small animals like rodents and birds, as well as livestock and horses. They do have a full service clinic that's attached to their Boston campus that anyone in Massachusetts can come to and bring their pets to be seen. And then specifically, I'm going to be talking about community services and outreach. So there's a lot of smaller departments underneath that big umbrella, including law enforcement. So law enforcement officers that go and respond to calls with concerns about hoarding or neglect, field services, and there are agents that go and they can respond to calls of trapped or loose animals, like mini rescue situations, and pet and community health, which is where I kind of fell into things in ARL. So in general, pet and community health, their focus is to assist pet owners with a lack of access to veterinary care and other resources. And they do this in a few different ways. They have a few different initiatives and programs to address this. So they have their Community Cat Initiative, which focuses on TNR and establishing relationships with community cat feeders and local trappers to make sure that their little communities are healthy and not reproducing. They also have the spay Waggin, which is a low-cost spay-neuter mobile clinic that goes around. They drive around the South Shore and Cape Cod areas and provide lower cost services, lower than what you would expect at a traditional stationary vet for residents in those areas. And then their most recent initiative is the Keep Pets Safe program. I'll refer to it as KPS. SAFE stands for Supporting Animals Facing Emergencies, and this initiative popped up as a response to COVID-19 as people were losing jobs. They wanted to make sure that members of the community still had access to food, pet supplies, and medical and preventative care that they may no longer have access to due to financial restrictions, illness, that kind of thing, in order to keep those pets in their homes and prevent unnecessary relinquishment. And then where I fell under all this was at the Wellness Waggin. So the Wellness Waggin, similar to its sister vehicle, is a low and sometimes no cost wellness and preventative care service that it just serves dogs and cats through this mobile clinic, which has its whole little vet suite inside. They primarily serve, due to their grants that they have for the Wellness Waggin, they mainly go to the Boston neighborhoods of Dorchester, Roxbury, Mattapan, and Hyde Park. Because those, through their research in developing this program, they found that those areas had the highest need for these kinds of services. And what they do is amazing. For someone that's interested in using the Waggin, there's a $10 fee for each pet. And included in that $10, you get an exam with a veterinarian, a rabies vaccine, distemper vaccine, microchip, flea and tick preventative, you can get a nail trim, and if you have a dog, you can also opt to get a heartworm test and prevention for your pet as well. And you can go as frequently or as infrequently as you like, and there's really no questions asked about joining. They are limited to those specific neighborhoods and those zip codes due to their grant funding, but if you're a resident in that area and you have pets, you can sign up, make an appointment to come to the Waggin. And something that's particularly awesome about Wellness Waggin is they strategically have partnered with human service organizations to essentially be another resource for the people that those human service organizations are already serving. So the organization that Wellness Waggin works with is called ABCD. It's Action for Boston Community Development. And so specifically, pre-COVID, they had 3 main locations that they would visit on a regular basis. So they were an established part of the community, and you know, citizens in that area could expect to see the Wellness Waggin, and that would be a regular part of their week. They knew that that was a resource available to them, and people that were using the ABCD resources could also say, hey, what's this Waggin? And they could get introduced that way as well. So Monday is Roxbury, Wednesday is Dorchester, Friday is Mattapan. It was a pretty routine schedule for them until COVID hit. So just kind of an overview of how ARL adapted to that conflict. So as we all know, in the middle of March, Mayor Walsh declared a state of emergency for Boston. At the end of March, so around March 23rd, there was a shutdown of non-essential services. So unfortunately, this included the Wellness Waggin. So no longer allowed to take the Waggin out to the community, complete shutdown of those resources and vet care for these people's pets. So come March, you know, end of March, beginning of April, ARL sought to come up with something to meet the people's needs without, you know, breaking social distancing guidelines and trying to follow local guidances to keep everyone safe. So for a brief period of time, they used formal and informal uses of telemedicine, so phone calls, video chats with vets. Sometimes they would go and pick up pets and bring them in for exams if they thought their need was that great, if they thought there was an urgent issue going on. And then, like I mentioned, that's when they started the KPS program to make sure that people had the resources that they needed to keep their pets. In June and July, they had kind of a soft reopening of the Wellness Waggin, which was very different from the previous ban in the community. People bring their pets. For June and July, it was a pet-only appointment, and field agents would actually drive out to people's homes. They would do a handoff of the pet from the owner to the field agent, and then they would bring them to the Dedham campus where they would get their exam and treatments, and then they would be dropped off that same afternoon. And then as of late July and going until now, luckily ARL was given the go-ahead to restart in-person appointments. So they initially were allowed to bring the Waggin back out to one site, and as of now they are back at their 3 typical ABCD sites, which is wonderful. And where I fit in, I came in right as they were doing the essential kind of reopening. So this was a new process for them in terms of doing the pickup and drop off, and I was just kind of in there to help make things work. So in terms of my externship, like everyone else has already mentioned in their presentations, it looked very different than what I expected. So down the bottom there, that was my desk. It was whatever flat surface could hold everything I needed. I became best friends with Google Voice because I primarily was talking on the phone all day, every day that I worked. And then there's my handy dandy assistant. He isn't the best assistant, but he's cute. And so while I was with ARL, like I mentioned, I was primarily on the phone. I was communicating with the public. Every day I would get a batch of voicemails or emails or messages from the community that needed responding to. So I primarily was returning calls and answering questions. So it may have been someone that was a previous Wellness Waggin client that wanted to get back in because they heard that the Wellness Waggin was doing business again. It may be someone that was brand new to the area or had never been in need of low or no cost services that suddenly did have a need because of their job situation changing. And there were a lot of people, and I'll talk about it briefly in a minute, who had suddenly acquired new pets. I know there was a huge urge for people to foster and adopt animals during the quarantine, and a lot of these people may not have had pets before or not had that age of pet before. So a lot of them had general wellness, health questions, behavior questions, and so I was kind of an intermediary resource between them and the vet to try to give them an idea of what to expect. In general, also, I did some general data entry and record reviews. So when people would call and say, hey, I've seen you before, I don't know what my pet needs, I would kind of be their guide through what medical records mean. And then I also worked on some mini projects. So I looked into chat options for ARL's website. That was a project that Cheryl was very gung-ho about, and she hadn't had time to look into it. So essentially I looked into ways to make that happen, so that way the website and ARL staff were more accessible to people in the community, and you don't necessarily have to go through the phone or a voicemail or an email. It's a much quicker way to get access to someone with knowledge. And then I also took a look at the Wellness Waggin's data that they kept on the human and animal clients, and I was particularly interested in how the quarantine months compared to previous years. So this is a quick look at that. So compared to 2018 and 2019, the period of March 1st to June 30th in 2020 had a lower number of Wellness Waggin clients that had previously visited a vet, so it was frequently their first time visiting with a veterinarian. There was a general decrease in the age of pets that were seeking out these services, and there was an increased number in the average number of pets per home, and a greater incidence of diseases like dental disease, obesity, skin issues, ear concerns, all of that. So it kind of makes sense. You know, why is this happening? It kind of makes sense within the context of COVID. A lot of people are being encouraged to adopt, or it may have been they had a spay or neuter appointment scheduled, but it got canceled. So there was an unexpected litter and you rehomed all those animals, or a community cat had a litter, you know, someone took them off the street. Everyone wants to make sure, you know, they want to take care of these animals, so they take them in. So you're having younger animals. A lot of times the people taking them in already had pets, so that increases the number of animals in that home environment. And since all the vet services were shut down for a period of time, a lot of them hadn't even had the opportunity to visit a vet at all. And because of that also, they were often made to delay their vet visits in cases of, you know, dental issues, or, you know, they could have gotten resources for weight management at a vet, but they didn't really have that option. And primarily, as much as we love the animals and it is about taking care of the animals physically, it's really about supporting the people in the community and providing what we can for them. So really, you know, after talking to hundreds of people, everyone wants to provide for their pet. They never approach the Waggin saying, I didn't really care about them, like, I don't care that they get vaccinated, but I'm being forced to, or there's never any poor intentions behind any neglect or inability to seek vet care. There's really a lot of obstacles in their way that are preventing them from getting the kind of vet care that they need and that they're wanting. And this externship came at a time of a lot of discussion about the intersectionality of things. So there are a lot of systemic inequalities, especially in the Boston area, that have been compounded by COVID-19. So the neighborhoods that Wellness Waggin services are primarily resided in by people of color. They tend to have lower incomes, and there's higher levels of poverty, as that previous map showed. A lot of the people that I spoke to reported they were immunocompromised, they had other conditions that could potentially make them more susceptible to COVID. They were on disability or recently put on disability. A lot of people in these neighborhoods are renting. And of course, there's the current concern about the end of the eviction moratorium. So that's kind of an ever-present concern for these people. And there are a lot of people that are either essential workers that were forced to work during the quarantine because they needed income and they were considered essential, or there were people that were furloughed or laid off. So a combination of all this really led to a need for these services, and Wellness Waggin sought to make that possible in the best way that they could, considering what was going on. And then in addition, COVID also kind of exacerbated the issue of veterinary deserts. So when there's a lack of access to affordable veterinary care. So like I mentioned, a lot of vets closed down or became emergency only, or they're doing curbside services, but they still may not be affordable and accessible to the residents that need them. And that's really, I got a lot of calls from people that said they don't normally visit the Waggin, but their vet was closed. They had made dozens of calls, and we were the only ones that were open. And so in general, after talking to everyone and kind of seeing what everyone was going through, this experience really prompted more internal reflection. So, you know, I heard a lot of stories of from clients that were homeless or had recently taken in animals from a friend or a family member who had succumbed to illness. And they all said, I want to do as much as I can for this pet. You know, I'm limited in my options. I don't have a large income, but I want to do what I can. Can you help me? And so there's always that sense of pets helping their people and people wanting to do their best for the animals. In addition, since I was pretty much solely on the phone, there was an increased awareness for me of how I use my words, which sounds kind of silly, but the instance I like to use, it was kind of an aha moment. I was on the phone with someone and describing all the services that are offered. Like I mentioned, it's $10 for all of those services. And they asked, you know, how much does this cost? And I said, oh, it's just $10. And it kind of clicked for me. The word just, it's just $10. For us, for a lot of people, $10 may not be that much to spend at a given thing. You could spend it on a cat toy and it doesn't really make an impact. But for a lot of people, $10 can be something you need to plan out for in advance. So being aware of how I'm speaking and taking into account other people's experiences, you know, avoiding bias and assumptions as much as I can. And kind of that last point there touches on that. So it's always an active process to work against those assumptions, the privilege, any biases, even if you've kind of gone through that recognition of, oh, I need to do X, Y, Z to be more open, non-judgmental of the people that I'm working with. It's not a one-time thing. So it's a constant active process to work against those kind of just general assumptions that you run with and you might not even be aware of. And then something that Cheryl said that really stuck out to me during the summer was people always know when you're truly advocating for them, which makes sense. But in talking to someone on the phone, they can tell if you're really trying your best to make an appointment for them, to make things work for them. So I would always try my best. I would imagine myself on the other end of the phone. If I had a pet that I had concerns about, but maybe wasn't an emergency, I would hope that someone would try their best to get me in sooner than later. And that's something I tried to do. You know, I would tell them, you know, hey, it looks like we have something 2 weeks out, but I'm going to try my best to see if we can get you in earlier. And luckily, the staff at ARL is very, very kind and very considerate and very accommodating. And so I would send a message off to my supervisors, Sam and Laura, and they would say, you know, it looks like we can squeeze them in on Monday, and today's Friday. Just let them know to come in and we'll make it work. And that really shows when you do actively try to do that, and they appreciate it. I got so many things on the phone, and they don't know I'm just the phone person, but they really appreciated everything that we were doing, from the phone communications to the in-person exams and treatments. And then just to briefly cover what I did my research paper on, because it's kind of tangentially related, I looked at veterinary teleservices during COVID and kind of what to look at beyond this point. So I did a general history of the use and implementation of teleservices, telemedicine in human medicine, and its slow adoption into the veterinary medicine community. I briefly looked at the use of telemedicine at ARL during COVID, so that kind of late March, early April period. They had, like I said, some formal telemedicine appointments, some informal, so I kind of looked at what pets use that and what the outcomes of those appointments were. And then I made some broad recommendations on what seems to be working in terms of telemedicine and potential future uses for it within community medicine and the community medicine department, considering that the Wellness Waggin is in high demand for many reasons. And some of the reasons that people might be making appointments may not require an in-person appointment. So trying to make the most of what resources they had to reach as many people as they can. And let's see, so what's next for me? I finished my externship in late August, and I've just recently accepted a community outreach specialist position with the Atlanta Humane Society. As many of you know, prior to MAPP, I was working inside the shelter at Atlanta Humane, and now I get more of a chance to work on the outside with the local Atlanta communities, hopefully doing some of the stuff that got canceled at ARL due to COVID. And then thank you to all of the MAPP staff and faculty, to Dr. McCobb and Cheryl for taking me in, for Laura, Sam, and the ARL community for letting me bug them with a lot of questions and letting me be a floating head on the screen sometimes. Dr. Rutberg and all of the staff, Ginny, thank you so much. And a special thanks to Aaron King and the Tisch College of Civic Life, similar to Blythe. Tisch was very generous in supported and funded my externship as well. So I'm very grateful to them. And then of course I have to thank my family, my friends that have supported me, and my cat that's sleeping in a corner because like I said, he's not the best assistant. So thank you guys so much. And are there any questions?
I have a question. I don't know if it came up at all, but I am curious if the new shelter regulations did impact your work at all.
Let's see, which regulations were those, if you could elaborate?
There were new Massachusetts regulations that I don't think have been implemented yet. I think there's a 1 year or 2 year.
Blythe, it didn't impact her because she wasn't working with shelter animals. She was only working with the community-based programs. But behind the scenes, ARL was engaged with implementing the regs.
Yeah, I didn't know if it came up at all or if she heard it. I heard a lot of varying opinions on the regulations, so I just didn't know if she heard something.
It's a hot topic.
Hello.
Hi.
Thank you, Mavis. Let me ask one simple question related to this good presentation. I've seen that you have been working with the animal health setting, and I would like to ask how are these animal treatment regulated or managed so that they reduce the contribution of the use of these medicines to treat animals, which is contributing to high level of antimicrobial drug resistance. This is a good or an important issue, specifically for us in the developing countries, because animal treatment is known to be one among the contributing factor to the increase of the antimicrobial drug resistance, which is also a problem because we are tending to miss medicines to treat even humans. Thank you very much. What are the strategies you are using to monitor or to manage this animal treatment so that it does not contribute a lot to the antimicrobial drug resistance? Thank you very much.
Yeah, so that does kind of fall out of my realm because those kinds of treatments are up to the discretion of the vet staff, and I wasn't able to talk to them about that. Wellness Waggin specifically is mainly limited to preventative care. So it is just like flea and tick preventatives, heartworm preventatives, animal vaccines. Occasionally they'll deal with infections or something like that, or post-operative care that requires medications like that. But as far as I know, they're not trying to kind of overuse or abuse those kinds of antibiotics that contribute to that. And that would be kind of more of a question for their veterinary staff there and how they decide when to use what.
Okay. Thank you very much.
Thank you.
All right, anything else? Okay, thank you, Mavis.